but it doesn't go to my slides. Okay, thank you. Sorry about that. So we're here to discuss Medicare and Medicare Advantage. Again, I've been in this market since 2004, since the Medicare Modernization Act was passed, and so this is our specialty. Now, can anybody tell me when Medicare was enacted into law? Does anybody have an idea? Just shout it out. It was 1965. 1965, Medicare was enacted into law, and it is arguably the most successful government program in history. In 1965, I know all you folks are way too young to remember 1965, but I can remember 1965. And in 1965, most people died in their 60s. If you lived to be 70, you lived a nice, long life back then. Now, if you live to be 70, you're middle-aged. People live to be 90 and 100 now. Now, why is that? Well, two reasons. One is we've had some fantastic advances in medical science. But the other reason I am convinced is access to care. And that is because of Medicare. Medicare is universally supported. It was first proposed by President Harry Truman, who was a Democrat. It was supported by President Eisenhower, President Kennedy, President Johnson, who enacted it. It's been updated by President Clinton, President George W. Bush, President Obama, President Trump, and it is supported by President Biden. It is supported by everybody from Bernie Sanders to Donald Trump. Everybody supports Medicare. The question is who pays for it, how you get it, and who qualifies for it. But back in 1965, there were very few people in the in Medicare because most people died when they were 68, 69 years old. President Johnson, who passed Medicare, died when he was 64. He did not live to get his Medicare card. So there were very few people on Medicare and tons of people in the workforce. So they decided that everybody had to get a little skin in the game so that everybody was going to pay a little copayment for services. Otherwise, they'd be going to the doctors if they had a hangnail, So they had very small copayments back in 1965 because there was so much money in the system. Well, over the course of time, that has reversed, and now there is a tremendous amount of people on Medicare and few workers in the system. In Florida alone, there are 4.3 million people on Medicare today, and more all the time. All those folks that are moving down into Florida, most of them are Medicare aged, and most of them should have my card because when you move into Florida, you have to change your health insurance, and I'm the person to see because I represent all the different carriers. We're not here talking about any specific carrier today because I am an independent agent. I represent all of the carriers. But the problem is over the years, the out-of-pocket expenses have grown tremendously. And that is because there is less money in the system. So today, if you just have Medicare A and B, Medicare A is your hospital coverage. Medicare B is your doctor coverage. And that's with that little red, white, and blue card that they send you when you turn 65 is your Medicare card with Medicare A and B. If you just have that card and you go to the hospital today, this year they're going to charge you $1,364 to walk in the door. Next year it's going to be $1,406, I believe, because it goes up every year. $1,408 next year. Similarly, for the doctor's office, you have to pay a Part B deductible of $185, and then you pay 20% after that. So the out-of-pocket costs are very high, and that's where Part C comes in, Medicare Advantage. Medicare Advantage was created as an alternative way of helping to address those high out-of-pocket costs. And at the same time, Part D drug coverage was passed. Before 2005, actually, when this went into effect, there was no universal drug coverage for senior citizens. None whatsoever. If you had a particular plan that had drug coverage, great. Otherwise, you were on your own. And I will tell you, the happiest year of my life was the year 2004, when I visited hundreds and hundreds of senior citizens. I was working in Fairfield County, Connecticut, then in Fairfield County and Westchester County, New York, and brought them their drug insurance policies. They wanted to kiss me. They wanted to marry me off to their daughters. They wanted to carry. They were so happy. They were so, and the horror stories I heard about people who at that time saying, you know, people had to eat cat food so that they could get their medication. Well, nobody has to eat cat food anymore because everybody has Part D drug coverage. And that came in at the same time as Medicare Advantage. Whoops. Other way. Okay. So the hospital deductible, again, Part A. If you just have Medicare Part A, $1,364 deductible for the first 60 days. Plus, and that's just basically for your room and board, plus you're subjected to 20% of doctor's charges. So if you have a doctor, you have an operation, you have meds and testing and all that, you are subjected to 20% of that. You could be in the hospital for 3 or 4 days under Medicare A and B and owe $4,000, $5,000, $6,000 or more. I see people shaking their heads. Yes, they probably are familiar with that. The days 61 through 90 and 90 through 150 are not quite that important because most people are not going to be in the hospital that long. But suffice it to say, the 1364 counts for the first 60 days, and after that there is a per day charge. So the out-of-pocket cost, the point is the out-of-pocket cost can be extremely high. Medicare Part B, $185. That's going to go up next year. It goes up every year. $185 for your doctor services, and then you pay 20% of the Medicare amount. So if you go to the doctor, if you just have the red, white, and blue card, you go to the doctor beginning of the year or early in the year, and the doctor charges you $200, you have to pay $185 plus 20% of the $15, and then you pay 20% from there on out. So it can get to be extremely expensive. So we advise that everybody should have some type of an option to address those out-of-pocket costs. You don't want to just have a red, white, and blue Medicare card. And, of course, you need to get a Part D drug plan anyway. But if you just have the red, white, and blue Medicare card, those out-of-pocket costs can be very, very high. So what are your options? Basically, there is the traditional option, the option that has been around since 1965, and that is the purchase of a Medicare supplement plan. A Medicare supplement plan is a private insurance plan offered by an insurance company that does precisely what it says it's going to do. It supplements your Medicare. And in most cases, it pays for most, if not just about all, it used to be all, but it's close to all of your out-of-pocket expenses now. And that is kind of like the Cadillac version of getting your Medicare. And then, of course, you have to get the Part D plan as well as a separate a la carte item. But those plans can be very expensive. Right now, if you got the best, if you were 65, because it depends on your age and it depends on whether you smoke, it depends on your sex, but if you're a 65-year-old non-smoking male in Southwest Florida, it's going to cost you about $185 a month to get the top plan that covers just about everything. Then your drug plan is going to cost you another $40 to $50 to $60 a month. So you're talking almost $250 a month for your coverage, whether you use it or not. You're kind of prepaying for your health insurance. So back in around the turn of the century, the early part of of the 2000s, they decided that they had to have a different option, that people could not pay all this money for these supplement plans, then they're going to have to pay for the drug plans, that there had to be another option. So they invited the insurance companies into the game. They created Medicare Advantage. Medicare Advantage is option 2. It is the private version of Medicare. It is Medicare run by your insurance company, whether it's Aetna, whether it's United Healthcare, whether it's Humana, whether it's Florida Blue. They run your Medicare. And in Florida, we are fortunate because we have so many wonderful senior citizens in Florida that we have some of the best rates going. Virtually every plan that we offer to folks has a 0 premium, which means that you don't pay for anything. We can't say it's free, but you don't pay for anything out of your pocket, because that comes from the Medicare money that is set aside from everybody. That goes to the insurance company, and the insurance company can provide your Medicare. So those are your options. Both options are good. There's no right. There is no wrong. It's just that option 2 is a lot less expensive than option 1. Now, for certain people, though, if you have a lot of chronic health conditions, option 1, or a lot of money, option 1 may be the best alternative. And that's part of what we do. Part of what we do is we look at your situation and we see what is the best alternative for you, what's the most cost-effective alternative, because the idea is for you to spend as little money as possible and to get the best plan possible. Okay, what's going on here now? Oops. Oh, it's telling me something here. Your battery is low. Okay, well, we're having a problem with that. Anyway, I know what's on the next slides anyway, so yeah, if you can get somebody to help, that would be good. But what are the common types of Medicare Advantage plans? HMOs, PPOs, and PFFS plans. All of them are networked to one degree or another. A PFFS plan has less of a network than the other two. HMO is a health maintenance organization. That means that typically you'll have the lowest out-of-pocket cost, the lowest cost for your doctor, lowest cost for your hospital, but you must go in network, and you must get, oh, here we come, and you must get approvals. We can't make this thing advance. Okay, so requirements for Medicare Supplement and Medicare Advantage plans. You must have Medicare Part A and Part B. Now, everybody gets Medicare Part A by virtue of their work. You pay for it in your FICA deductions from your paycheck, or if you work for yourself, you send it in to Uncle Sam on a quarterly basis. Whoops. It totally went out. That's okay. I've been doing this for 20 years. I can do it from memory. So everybody gets Part A. Part B you have to pay for. Again, you have to pay about $145 for it. That's going to go up a little bit this year. And you get a chance to opt out from Part B. If you want to opt out, if you still have employer coverage, for example, you're not going to want Part B, because you're being employed, you're covered under your employer's plan, so you would opt out of your Part B. But most people will take the Part B, because the Part B allows you to get into all of these other programs. You must have Medicare Part A and Part B. You must live in the service area, which I was referring to when we're talking about this people moving into Florida. All health insurance in the United States is state specific, which means that if you move from one state to another state, you need to get new health care and new health insurance because your health insurance is not going to work long term here. It may work for a short period of time, but not long term. So if you move to Florida, you need to get Florida health insurance. That goes for whether it's regular health insurance, Obamacare, or whether it's Medicare. So you must live in the area, which is basically the state, or in some cases the county, and that's basically it. So back to the types of plans, we have the HMO. Again, you have to be in network for the HMO. And also with an HMO, you have to get referrals for specialists, and you got to get pre-approval for certain procedures, for most procedures. But typically, that's not all that hard to do, and the doctors around here know how to do that, and we don't have too many problems with that. When we first started offering these plans, we did have some problems with that, but they're becoming very common now, and the doctors know how to handle them pretty easily. The second type is a PPO. That's got a network as well. It's called a Preferred Provider Organization. But you can go in or out of network. You would generally pay lower copayments if you go in the network. You will almost always pay lower copayments if you go in the network than if you go out of the network. But if you have to go to a certain heart specialist or cancer specialist or somebody who's not in the network, you can do that. You'll simply pay a higher copayment. The third type, which is very uncommon now, was very common when we started offering these plans, is a private fee-for-service plan where you can essentially go to any doctor. Sometimes they have networks and you get a slightly lower copayment when you go to the doctor, but with a private fee-for-service plan, you can pretty much go to any doctor who accepts Medicare, which is the same as with if you have the option 1, Medicare, and the Medicare supplement plan, you can go to any doctor in the United States who accepts Medicare and accepts the supplement plan. And I will tell you, if they will accept Medicare, they will accept the supplement plan. In fact, if you tell them you have a Medicare supplement plan, they will do cartwheels and say, come on down first thing in the morning, because they'll get the most money, the highest payments that they can have through the supplement plan. But the idea is not to make money for them. The idea is to make money for you, because we represent you. We don't represent the doctors. We don't represent the insurance companies. We want you to have as much money in your pocket as possible, because you're retired. You're in Florida. You're living a good life. You want to go fishing. You want to go golfing. You want to go and play bingo with your friends. You don't want to worry about Medicare, okay? That's my job. My job is to do that for you. I'm your Medicare guy. You know, if you you have a heart problem, you're not going to get your neighbor to give you a heart transplant. You're going to go to a heart specialist. You know, if your car breaks down, unless your son's a mechanic, you're not going to have him fix your car. You're going to go to a mechanic. You know, well, if you have a Medicare problem, you come to Dave, because I'm the expert, and I can explain how it works. Now, the other element of all this is the Part D drug coverage. And the Part D drug coverage is important because nobody has to pay full price for any drugs anywhere along the system now. The Part D drug coverage, just to summarize it, and you know, if anyone wants to talk to me afterwards, we can go into greater detail about this, but there is a coverage phase, which is a very generous coverage phase at the beginning. Then there is what used to be called the donut hole, because it used to be no coverage in the donut hole. The donut hole is done now. In the donut hole, everybody pays 25%, which is considered to be the standard copayment for Part D, so that you are covered in the donut hole. And then if you, heaven forbid, should have a tremendous amount of drug expenses in any one particular year, after about $5,000 or $6,000, we'll get the exact figure for you, there is a catastrophic coverage feature in which you typically pay 5% for your drugs, or a minimum for generic or brand name drugs. So you got very, very strong catastrophic coverage. very strong and generous coverage on the front end and coverage in the donut hole. Now, when can you sign up for these plans? Anybody can change a plan anytime between October 15th and December 7th. That is called the annual enrollment period. And because the way these things are set up, there are networks of doctors. The insurance companies need to know that you're going to be on that plan for a while. You can't just come in and out willy-nilly. But there are other opportunities. For example, you can sign up for as many plans as you want during the annual enrollment period, and the last one that the government receives will be your plan. And you also have a chance between January 1st and March 31st to change your plan. If you get in that plan and you see in January or February, hey, this is not going to work for me, you call Dave up. Dave will find you another plan, and we'll get you into a different plan. So you can do that as well. But that still leaves 9 months of the year. What happens if you turn 65 in June? Or you move to Florida in July? Or your employer says, son, you're out of work as of September. What happens with that? Well, that's what we call a special election period. You have a special period in which you can elect one plan. You do have one option during that plan, so make sure it's the right one. But for moving in, turning 65, losing employer coverage, and there are a number of other circumstances. Those are the three most popular. And then the other thing is if you have Medicaid. The difference between Medicare and Medicaid, everybody gets Medicare. People who are financially challenged get Medicaid, and they need to meet certain asset and certain income levels in order to get Medicaid. And just for example, this year in the state of Florida, Medicaid is a state and federal partnership. Medicare is a federal program. Medicaid is a state and federal partnership, so it differs from state to state. But in the state of Florida, an single individual can qualify for Medicaid if he or she makes $984 or less per month and has less than $6,000 in assets. So you've got to be fairly challenged. But if you have Medicare and Medicaid, you don't pay anything for your doctors. You don't pay anything for your hospital. You pay very low co-payments for your meds. And in addition to that, the insurance companies all have additional plans for people who are dual eligible, which can do things like provide you $50 worth of groceries in a month, or trips to the Publix. I mean, some really sweet benefits for people who are on Medicaid because they need it, because they don't have a lot of funds, and so that's basically it. That is it's Medicare for everybody. Medicaid, if you're challenged, the insurance companies have programs for both people who are on Medicare and people who are Medicare and Medicaid, and your options are either straight Medicare and a supplement plan and a Part D drug plan, which again could cost you about $250 a month, or a Medicare Advantage plan, which in most cases will cost you $0 per month. And needless to say, about 95% of my clients go into the Advantage programs. But they work beautifully. They all work beautifully. The doctors are very familiar with them. And part of what we do in trying to find the best plan for you is we ask you who your doctor is, find out what plans what networks your doctor's in, that sort of thing. And find out if you do a lot of traveling. If you do a lot of travel, you travel out of state, you might want a PPO. You want a plan that will travel with you. If you're landlocked into Charlotte County, a good HMO is fine, and you pay nothing to see your doctor. So, but again, our job is to kind of figure out what is the best plan to meet your needs, and if you don't like any of them, that's fine too. And if you get in a plan and you say, hey, Dave, I don't like this plan, well, we'll get you in another plan either in the open enrollment period, January to March, or the following year. But every year you have a chance to reevaluate your coverage. And what I would advise you to do is, if I am a lifetime New York Jet fan, and I see Joe Namath on these commercials. Do not call the number that Joe Namath is going to give you. That is an insurance company that is going to try to sell you something. Call an independent agent, whether it's me or somebody else. Call an independent agent who works for you and doesn't work for the insurance company. Anyway, any questions? Yes. Yes. Ignore the phone number. That's my old phone number. Ignore that phone number. The phone number on the card is the good one. Oh, okay. Yep, the consult side. Or I've got